Meet Isabella, a 4-year-old quadruplet who has cerebral palsy and is working with Lexington's early intervention program on physical and verbal development. Her determination and attitude are not only an inspiration, but a model for success.
In the very beginning, we had absolutely no idea that Isabella had any disability, but because she was premature, we had to go to the developmental specialist. It was at that appointment that they told us that they felt that she had a neurological problem, but we'd wait and see. Well, by the time we went back at a year of age, no one needed to tell us. We knew she was disabled. So we went into that appointment thinking, we really want to start physical therapy for Isabella, and we want it to be done right away. And after that, Emily came from Lexington, and the first day she came in was one any of us will ever forget.
I started seeing Isabella when she was just a year old, and at that point she was able to sit up on her own, but she wasn't able to move in or out of sitting on her own. She could only sit if you placed her in sitting. She wasn't rotating her trunk at all and just pulled herself around on her belly. She couldn't crawl on her hands and knees. She couldn't pull up to stand. And she obviously has 3 siblings that were doing much more than she was at that point. They were all learning to walk pretty much, and she was definitely lagging behind a little bit. So Mom and Grandma had some concerns, and the doctor referred them to early intervention.
I started working with Isabella when she was about 2 years old for speech and language therapy. With the forward tongue placement, we did a lot of drinking therapy with the straw so that she could use the straw to help pull her tongue back in her mouth, because that, of course, affects speech as well. The horn blowing is also used to help pull the tongue back in the mouth. Any kind of blowing activities encourage that. And you need to have your tongue pulled back in your mouth to produce a lot of speech sounds. So that's why those activities are important.
I really would recommend for any family to really be as positive as possible. It's heartbreaking at first when you learn your child's disabled, but there's much more positive than negative. Children like Isabella don't only do just great things, but they're inspiring to other people. For example, Isabella is very comfortable in her skin. That's a lesson probably all of us could learn. And so we've enjoyed the journey of Isabella, and just as any parent should absolutely enjoy every moment with their child and sit back and watch the growth and rejoice in it.